Healthwatch Inclusion for All Action Hub 14th of September 2020 Zoom meeting. Attendance: Tatum Yip, Healthwatch Leeds Community Project Worker; Anna Chippendale, Healthwatch Leeds Administrator and Project Support Worker; Christina Kozlowska, LTHT Head of Patient Experience; Janice Green, LSDPP CEO; Sharon Moore, Leeds CCG Equality and Diversity Manager; Helen Butters, Leeds CCG Communications and Engagement Team; Julie Royal-Evett, LYPFT Strategic Health Facilitator; Elaine Ray, LCC Adults and Health Principal Performance and QA Officer; Sayed Ahmed, LYPFT Patient Experience Lead; Claire Nixon, Advonet Asking You Manager; Hannah Davies, HWL CEO; Aaron Fenton, Forum Central Mental Health and PSI Development Worker; Jonathan Phillips, HWL Board Member; Howard Beck, Leeds City Council Commissioning Manager; Steph Selwood, Change Manager; Hilary Adolphson, National Federation of the Blind Secretary; Andrew Barnes, Deafblind UK Outreach Officer; Christina Jessup, Leeds Hearing and Sign Loss Service Manager; Luke Aylward, Autism AIM Information Officer; Peter Lomas, People with Lived Experience; Holly Bufler, Leeds Care Record Business Analyst; Heather Thrippleton, LCH Patient Experience and Engagement Lead; Rosie Horsman, LTHT Patient Experience and Involvement Lead Nurse. Apologies: Holly Danhauser, Leeds City Council Health Partnerships Team Partnerships Development Manager; Jason Hickson, LSDBP Chair; Alison Potts, Healthwatch Leeds Volunteer; Rachel Koivunen, People in Action Manager; Elizabeth Micklethwaite, Leeds CCG; Michelle Cale, Leeds City Council Commissioning Manager; Jez Coram, Forum Central Learning Disabilities Development Worker; Victoria Tredenek, Commissioning Manager Learning Disability and Autism; Madeline Fye, Connect in the North; Mark Healy, Advonet; Mary Naylor, National Federation of the Blind Chair. Abbreviation list: Accessible Information Standard AIS; Healthwatch Leeds HWL; Leeds Hearing and Sign Loss Service BID; Leeds City Council LCC; Leeds Community Health LCH; Leeds Teaching Hospital Trust LTHT; Leeds and York Partnership Foundation Trust LYPFT; National Federation of the Blind NFB; NHS Leeds Clinical Commissioning Group Leeds CCG; Terms of Reference TORs; Leeds Care Record LCR; Friends and Family Test FFT; Leeds Society for Deaf and Blind People LSDBP.
Part 1. Organisation's Reflection on AIS Work Progress. Organisation and Progress. LTHT. The Trust didn't initially have a mechanism for improving implementation of AIS, so it rolled out Working Group, which provides oversight by senior people. Project now underway, identifying how improvements made in one area of Trust can be rolled out elsewhere. Initial stage is data collection. Trust recognises that IT is central to implementing AIS well, i.e. recording people's needs. Central IT system is now being upgraded as a result of work by the working group. Trust is delivering new way of ensuring interpreting is available. Number of easy read leaflets has been increased during COVID and well received nationally. LTHT has new building in progress at LGI, taking into account what it needs to look like to support people with comms/accessibility needs. We'll be engaging with people from different communities. LYPFT. 3 core areas: patient experience, equality and inclusion, continuous improvement. Plan, do, study, act, project, rolled out for AIS. Trust has assessed the info and resources on Easy on the I website used by staff and patients, mapped which services/reception areas use the resources. Has gathered a lot of baseline data about how staff are capturing info about comms needs. Records do follow people from outpatient, inpatient and back. Minimum data set now captures key information about equality monitoring, but much more too. Carers, former members of Army, etc. Lead CCG. Systems and processes are set up, but qualitative side needs improving, i.e. patient's experience side. Access for all group will replace previous working group and will include an extended membership. First meeting is due tomorrow, covers AIS and more. AIS is now included in contract monitoring framework for GP practices, so they will be assessed against AIS. Work underway to raise profile of AIS within CCG. Challenges around providers include them asking about comms needs. Comms needs are being recorded much more often on one of GP's systems, but not the other. Work underway to figure out why. Leeds City Council. AIS having been implemented over the past 10 months, LCC is now part way through a report into the systems actually being implemented, reviewed annually. Also looking at AIS and COVID, speaking to social workers to find out problems at the front line. While main system is AIS compliant, LCC is now looking for secondary systems. Examples of issues in past reports. People not being asked about comms needs. When someone has dementia, their legal informal advocate is recorded in different ways. Key issue now is compliance with systems in place. Third sector. AIS doesn't apply to all third sector organisations, but good work is being done by many nonetheless. One of the biggest initiatives during the pandemic is Communities of Interest Network, which has been hearing a lot about health inequalities and championing needs for accessibility. Learning disabilities, linked with Health Task Group. People's Parliament focused on being well, healthy eating, health checks. Being well strategy for people with LDs, coming to end of time frame, so will be reviewed shortly. Lots of partnership, working with statutory providers, including shared learning. Grants from 100% Digital have really helped, working to make upcoming events as being made as digitally accessible as possible. Local care partnerships work, HANA, HWL, linked in with winter planning workshops. Lots of strategic groups regarding mental health, FC sits on one regarding comms. Danny, a third sector information governance officer, is in place at LCC, integrating LCR with third sector data. How do third sector and statutory data link up? LCH. Year 1 of LCH's accessibility strategy was to get picture of how the organisation is performing against AIS, especially as regards consistency across a hugely wide range of services. In January, LCH did AIS audit across 70 services, was clear that mechanisms are in place for staff to record comms needs, and that resources are mostly in place so that staff can meet needs. The bigger challenge is communicating needs across systems. Key wins over the last 10 months, all versions of FFT are available in Easy Read. Different versions of documents are now available. All communications sent out about comms needs, animated videos have been created for COVID-19 and digital appointments. Progress will be audited again. Intranet is being rebuilt so that staff gets easy access to resources. External website also being updated. Health Watch leads. Message pre-COVID was around the need to improve health of poorest fastest. During COVID, lens on inequalities has got even stronger. Key parts of HWL's work around AIS is digital inclusion. People's Voices Group has produced a report focused on inequalities. Links together digital inclusion and AIS. Citywide Health Inequalities Group now in place. HWL sits on it and has highlighted importance of AIS. Part 2. Lived Experiences. Asking You. Advanet. Passes any info gathered to Health Task Group. Systems are changing and being tested on the Asking You group, but the issue is that although accessible info is provided, GP practices are sending it out in all different ways. Peter. Doctors are shut, i.e., they're accessible by phone only. Peter has had to pay to get his ears treated privately as a result. LSDBP. Varied picture among GPs. Some services are willing to work with the person's preferred format, whereas others are less flexible. However, there is certainly a willingness to push forward an agenda. Leeds BID. People have had really bad experiences of accessing food banks as a deaf person. Christina will contact Elaine separately. We're doing great things as a city recording information, but the bigger problem about feeding back in BSL. More work needed to ensure general info regarding national/local COVID requirements is clear. Letters continue to be sent out inappropriately to blind people. Ongoing issue with face masks and lip reading. Howard. AIS needs to work in two directions, i.e., the deaf person needs to be able to give information back to services. Mary. Feedback via Tatum. Really pleased to hear about action services have taken, but so few people have accessed services over the last few months, it's hard to know about the reality on ground. A lot of people who Mary has spoken to found the information around COVID from central government difficult to follow. Deafblind UK has heard feedback nationally that COVID information is inaccessible. Autism AIM. AIM is putting together resources about accessing health services and how people with autism can communicate their needs about how they receive information. Again, confusing guidance about coronavirus remains an issue and will continue to be so if we go back into local lockdown. AIM is creating a recovery plan to help autistic adults plan how they get back to normal or near normal based on feedback from clients. Health Facilitation Team. Awareness about reasonable adjustments is low, so I've created a care plan which gives practices and patients a stable basis of information. Please refer to Get Checked Out Leads at https://www.getcheckedoutleads.nhs.uk/. Lots of projects going on in City. We need to link them up across services. Part 3. Next steps. In summary, two key issues have emerged out of today's meeting: staff compliance and creating a city-wide approach. AIS survey. Is it too soon to assess progress, especially given that not many people have been accessing services under COVID for various reasons? Would it be better to work with BID, LSDBP, etc., and do some more targeted work? General agreement that it is too soon because lots of standard work still isn't happening in GPs and hospitals. Also risk of second lockdown. Maybe we could do something else in meantime so that people are aware that we still want to know whether their needs are being met. We could look specifically at COVID barriers in the first instance. Need to consider how we're gathering views from people without digital access. It may also be useful to differentiate between health and care. Communities of interest network is also there to promote any surveys, etc. What next for our meetings? General agreement that we shouldn't set up a separate group to look at comms issues that aren't covered by AIS, mainly due to a lack of capacity. We should eventually broaden the focus of this meeting instead. Group will focus on AIS for rest of year, but consider switch to broader issues in January. Offer still remains that we can make a minute-long video promoting improvements that your organisation has made, or film a service user highlighting impact on the ground. Dex at HWL is creating video/promotional materials to highlight work we've done collectively. Please email Tatum by next Monday, 21st of September, if you'd like to be involved. Focus at the November meeting: Evidence of Improvement.